My name is Mosedi Namane. I am a professor in family medicine at UCT. I graduated from Faculty of Health Sciences in 1990. So I applied to UCT and I got into the program 1986, and then I qualified in 1990, and I was one of two first Black graduates at UCT. Strengthen community-based services. This was one of the policies of the new government. And then that's what also led to universities changing their curricula, adapting them for this primary healthcare curriculum. So I was in the first cohort that started building the discipline, writing textbooks, organizing for students, building the department, drafting the new curriculum. So it was kind of like the first. But it's not because, I was good in anything, but it's just because I was in our first. The dual role lended itself well to the situation so that I could marry the two, community-based education and primary healthcare delivery, just to make sure that there is fluidity between academia and community-based services. On a day-to-day basis, I'm coordinating for the learning of health science faculty students who are based at the site. They are doing what you call service learning. They are providing a service to patients whilst they are also honing their skills in whatever discipline they are following. For example, we've got audiology students, we've got speech students, we've got physio students, and in the past we had OT students as well. And the medical students are our final year students, equally because they are able to bring in a meaningful service, even if it's under supervision, The other thing that I like is that research. We've been able to produce community-based research that improves health systems. Something gets identified and we say, how can we solve it? And through research, we solve it and we are able to publish through that. I'm staying on at UCT as an emerita prof. And then in that space, my role will be to contribute to build our new discipline even further. And of course, teaching, I continue to teach, particularly postgraduate students. I've got students that I'm supervising, and I'll continue to supervise for their research work. I think I'm at a stage where I feel that I've given my all, especially for undergraduate education. We've written textbooks, we are doing things. The only thing is I'll keep on volunteering to update the chapters or working with others if I'm needed. I'm leaving my space being a happy person, and I'm satisfied. I'm satisfied because the systems are rooted. The seeds have been planted. They are plants. They just need to be nurtured for future.